À tous. Hello, everyone.
Good morning.
Je suis très heureux d'être ici ce
I'm very
matin
happy
avec
to
les
be here this
ministres
morning
Haidu
with
et
Ministers
Anand,
Haidu
ainsi
and
qu'avec
Anand,
la Dr. Tam
as well
et le
as Dr.
Dr.
Tam and Dr. No.
We have a lot of ground to cover this morning, so let's get right into it. I'll begin with vaccines. This morning, I visited the vaccination clinic at the Nepean Sportsplex here in Ottawa. It was great to see more and more people getting vaccinated. People are in a good mood. A lot of folks were there with their elderly parents. Everyone was chatty and focused, but quite frankly, it was the amazing volunteers who were working so hard who really encouraged us all, and we saw smiles on everyone's faces. I also had the chance to chat with a few of the many healthcare workers who are part of this vaccination effort. They're all doing an incredible job during this really tough time. My job as a politician is usually go around shaking hands, so that wasn't the challenge that we got to do. There was a number of older folks who I needed to remind that an elbow bump is the way we do it. But we're all figuring out how to navigate through this, and the fact that so many people are getting vaccinated is a really good thing. Our frontline workers have given up a lot to stay safe. Last week, I spoke to nurses from the Victoria General Hospital in Winnipeg. They shared what this past year has been like, caring for isolated patients in serious situations, sometimes being their only point of contact, and holding an iPad or holding their hands through a window while family members watch through a window. It was incredibly difficult, incredibly challenging for healthcare workers across the country, even more so when it comes to the fears that on returning home, they might be bringing home this disease to their families. It's been incredibly stressful, but they continue to step up every single day, and all of us need to make sure we're doing the best we can to keep them from getting overwhelmed and overloaded with new cases. But everything they do makes them the heroes of this pandemic. Présentement, notre plus grande priorité est de faire en sorte que le plus de Canadiens possible puissent être vaccinés le plus rapidement possible. Et on travaille sans relâche pour y arriver. À ce jour, on a livré plus de 6 millions de doses de vaccins aux provinces et aux territoires. Cette semaine, on va recevoir nos plus importantes livraisons jusqu'à maintenant avec 3,2 millions de doses. Ça inclut les livraisons prévues de Pfizer et de Moderna,
from Pfizer and Moderna, as well as 1.5 million doses of the AstraZeneca vaccine, which we will receive today from the United States.
As we've been saying for months, and as we've been planning with the provinces and territories since last year, the end of March will be followed by an increase in vaccine supply. We now have handily exceeded our promised target of 6 million doses delivered before April. And this week, we begin our ramp-up phase. Throughout April and May, 1 million doses a week are scheduled to arrive from Pfizer alone, plus Moderna, plus AstraZeneca. And for June, we have good news to share this morning. Pfizer has now confirmed that they will be moving up 5 million doses from later in the summer into June. That'll bring our total from 4.6 million to 9.6 million doses for that month alone. Of course, that's in addition to the other doses of the Moderna and AstraZeneca vaccines that we'll also get. A lot of doses being delivered means a lot of people who are able to get their shot. If you haven't had your vaccine already, it might be your turn or a family member's turn soon. If you want to learn more about vaccine safety and effectiveness, there'll be a Facebook Live event tomorrow where Dr. Tam, Dr. New, and other experts will answer Canadians' questions directly. To attend or get more information, go to the Healthy Canadians Facebook page. Today, I also want to talk about where we are with the virus and what that means going forward. In some places, cases of COVID-19 are holding steady or even going down. And especially in long-term care homes, vaccination seems to be making a real difference in protecting people from outbreaks. That said, hospitalizations from COVID-19 remain high, and case numbers are going up in many regions here in Canada and around the world. Variants of concern, which can spread more easily and make people even sicker, are increasing quickly. In BC, where the number of cases had been under control, they're now having to put in place new restrictions for the next 3 weeks. I want to extend my full support to Premier Horgan and to all premiers across the country as they make tough decisions to keep people safe. As we have since day one, the federal government will have their backs and do whatever it takes to save lives, to protect our frontline workers, and to support jobs and businesses until we get through this. Il ne reste que quelques jours avant le début de la fin de semaine de Pâques.
Easter weekend is just a few days
a commencé samedi dernier.
Away.
C'est maintenant la
Jewish
deuxième année de
Passover
suite
started
que
last
ces célébrations
Saturday.
se déroulent
It's
en
now
temps
the second year in a row that these
Malheureusement,
celebrations
ça
are
veut
taking
dire
place
qu'il
during a
faut
pandemic.
continuer de faire bien
Unfortunately,
attention.
this means that we
Dans la
must
dernière année,
continue
on a vu les
being
cas
very
augmenter
careful.
après d'autres
Unfortunately,
congés, comme
last
celui de
year,
l'Action de grâce
we
ou
saw
après
cases
Noël.
increase after
C'est
similar
très
holidays,
important
like
d'éviter une
Thanksgiving and
augmentation
Christmas.
après Pâques
So it's
si on
important
veut
for us to
continuer le
avoid
printemps
an
dans la
increase in
meilleure
case numbers
position
after
possible.
Easter. If you want to
Je sais que
continue
c'est
the spring in the
décevant, mais
best possible
il faut
position,
éviter les
I know
rassemblements.
it's disappointing,
C'est
but
pas
we
le temps
need
de
to
voyager.
avoid gatherings. This is not the
Continuez
time
de
to
porter
travel.
votre masque, de vous
Continue
laver
wearing
les
your
mains et
mask,
d'utiliser
washing your
l'application
hands,
Alerte
and using
COVID.
the COVID alert
La
app.
vaccination de masse
Mass
progresse bien.
vaccinations are
Le beau
progressing
temps s'en
well.
vient.
Beautiful
Mais
weather
il faut continuer nos
is
efforts un peu plus
is
longtemps.
around the corner, but we
Avec la
need to
hausse
continue our
récente des
efforts
cas dans
for a
certaines
while.
régions et
With the
les
increase
nouveaux
in
variants,
cases in
on
some
ne peut pas
regions and the
baisser
new
nos gardes.
variants, we cannot let our guard down.
Alors qu'on continue nos efforts pour
As we
protéger les
continue our
Canadiens,
efforts to
il ne faut pas
protect
perdre de vue que
Canadians,
la pandémie
let's
a
not
accentué
forget
les
that
inégalités à travers le
the
monde
pandemic
et a
has
eu un
widened
impact plus marqué
inequalities
sur
throughout
les
the world
populations
and
vulnérables.
has most
À ce
affected
sujet,
vulnerable
hier, avec le secrétaire
populations.
général des Nations Unies,
Together with the
Antonio
Secretary
Guterres,
General of the
le
United
Premier
Nations,
ministre de la Jamaïque,
Antonio
Andrew
Guterres,
Holness,
the
et
Prime Minister
plusieurs
of
dirigeants
Jamaica,
mondiaux,
Andrew
on a
Holness,
tenu
and
une
several
troisième
global
rencontre sur le
meetings, we
financement
had
du
a third
développement.
meeting on development
On a
financing.
discuté de solutions concrètes pour
Yesterday,
aider les
we
pays les
discussed
plus
concrete
gravement touchés par la
solutions to
crise
help the
économique
countries
actuelle,
most affected by the
notamment
current
en ce qui a
economic
trait au
crisis,
surendettement et à l'aide
particularly as it
internationale.
relates to
Il faut adapter nos
over-indebtedness and
systèmes
international
économiques afin
aid.
qu'ils répondent
We
aux
need
enjeux
to
mondiaux
tailor our
urgents
economic
tels
systems
que la
to
pauvreté
better
extrême,
respond
les
to
inégalités
urgent global
et bien
issues
sûr les
like
changements
extreme
climatiques.
poverty, inequalities,
Le
and of
Canada
course, climate
est toujours
change.
là pour
Canada
écouter
will
et pour
always be
agir.
there
Et on
to
va certainement
listen and to
soulever
act.
ces questions
And
lors de
we
nos
shall
prochaines
certainly
discussions
raise
avec le
these
FMI,
issues
la Banque
with
mondiale
our
ainsi
upcoming
que le
discussions
G20
with the
et le
IMF,
G7.
the World Bank, the G20,
As
and
we
the
rebuild
G7.
from this pandemic, we have to make sure no one gets left behind. Yesterday, Ministers McKenna and Monsef announced $250 million for transit in rural and remote communities. This fund is part of the unprecedented public transit investment we announced last month, and it is the first federal fund dedicated to rural transit. This is part of our job to create jobs and fight climate change. It's also about building more inclusive communities where seniors can get to their doctor's appointments and where people of every age can get the services they need. Before I end today, I want to say a few words about Easter and Passover. Again this year, we won't have the kinds of celebrations we were all hoping for because we just can't afford to let our guard down. I know I've said the same thing before every major holiday over the past year, but this time, what's different is that even if the end of the pandemic is in sight, the variants mean the situation is even more serious. We're entering the final stretch of this crisis. We just need to stay strong a little longer. More and more vaccine doses are coming every week, so there's reason to be hopeful. So please, keep yourself and your loved ones safe. Now is not the time to travel. Avoid gatherings and parties, and continue to keep your distance. I know it's not easy, but together we will get through this. Merci. Je suis maintenant heureux de passer la parole à la ministre
I'm
Anand.
happy to now give
Anita.
the floor to Minister Anita Anand.